Dr. Sheetal SAVUR. Next presenter, please.
A very good morning to everybody. So my paper is regarding an insightful look into incident reporting in ophthalmology. So a patient safety incident is any unintended or unexpected incident that could have or did lead to harm of one or more patients receiving health care. An inquiry is necessary to prevent recurrence. Targeted safety improvements help improve quality care. Reporting eye health related incidents is still in its nascent stages in India. So the hospital is accredited and staff and students are trained to report incidents. The details of the incident are described in a form which also include corrective and preventive action, and this is discussed in detail in the Safety Committee for Implementation. Our study aimed to describe and characterize safety incidents related to eye health in a teaching hospital in Karnataka. This is just a sample of the incident report, and it's clearly mentioned that incident reporting is not meant for blaming anybody or taking punitive action. Here the details of the incident, when it occurred, the description, the circumstance of it, and also the corrective and preventive action is described. So our study intended to study incidents that were reported in the Department of Ophthalmology between May 2022 to July 2024, almost a 2-year period. And this was in a teaching hospital in coastal Karnataka. And this was analyzed from the incident records. Only 10 incidents were reported. Actually, there were 15 that had occurred. And also, the description is there of the root cause analysis and the corrective actions. These were the common categories: medication errors, communication errors, equipment failures. And 7 incidents resulted in moderate harm, but no permanent morbidity. So in medication error category, in one of the cases, there was a discrepancy of wrong dose and duration in the doctor's orders and the drug chart, and it was a near miss. In another, there was a prolonged duration of the drug that was administered and which resulted in side effects. In a third, the verbal orders were not followed correctly and the patient received wrong medication. In communication errors, there was one particular case which resulted in hyperkalemia. This was an ICU patient, and primarily there was no communication between 2 departments that were treating the patient. And there was one case in which the patient did not inform the bystander regarding his vertigo and resulted in a fall. Then there were 2 equipment failures where phaco machines and the vitrectomy machine failed intraoperatively, and administrative error where patient had a fall due to wet bathroom floor and a staff member twisted an ankle due to slippery floor. So to conclude, incidents were underreported and mostly resulted in moderate harm. No non-clinical incidents were more than clinical incidents, and clinical incident reports were mainly in the form of medication errors, communication errors, and equipment failures. Improved reporting system and staff training mechanism reduce these errors and improve patient safety and outcome. Basically, we need more awareness regarding coming up with mistakes so that system flaws are taken care of and it improves patient safety. Thank you.
A very nice study, and it can be eye-opener for any institution. But the problem is, I mean, your hospital is accredited, but what about those hospitals? What message do you give to those hospitals who do not have accreditation?
Well, I don't think we really need accreditation system, but we have forums like this wherein we promote good practices of owning up your mistakes, not to be blamed, not to have individuals blamed, but the whole thing is to improve flaws in the system. I think attitude change will come slowly, but these are platforms where we can increase awareness, if not for accreditations that happen for each hospital or institution.
And you mentioned about staff training, but training is okay, but what about the implementation? That is the main issue.
Yeah, it's not very easy. Even if you're accredited, it's not easy. I think you have to persist. You must not give up. And it should begin from the top, wherein, the seniors start admitting that, okay, this went wrong. And you never punish somebody who owns up a mistake, because it's the system we have to change, not blame the person. That is very hard, but that is what is necessary to bring awareness
But
about.
some form of communication should be there for the person who was involved, or inadvertently that
No,
happened.
that then they get, they feel very scared. Nobody will report it.
How
then.
will they know that they have committed
No,
a
it's
mistake?
like a general thing. You change the system. For example, now a wrong IOL has been put. You don't tell you put the wrong, you didn't check. You devise a mechanism wherein you have a 2-level check. So you put that system in place, and automatically they will get into the system.
So, like, who is going to supervise this system?
As the head of the department, I'll have to do it, or there is quality department if you are an accredited hospital. It's not very difficult really to put a system in place.
Yes,
Not all
because-
that difficult.
Because we have a manpower problem in the government scenario also.
Yeah, no sir, it's very much possible. You need the will, that's all.
Okay.
Yeah.
This you have shown that so many error starting from the the medication error, communication error,
Yes.
and so when you come to the medical legal aspect, so that medical negligence, do you think that there is something which like related to the medical legal aspects, because we have shown 5-6 error.
Yes, yes.
So
Sometimes it can be. See, we got lucky that nothing happened. But yes, sometimes there can be. What if the patient with hyperkalemia had an attack or something? I don't know how the medico-legal error part will work in this, because in Ofthal we really don't come across, but I'm not really very sure
So
about
here
this.
is
There is
the-
an implication though.
Yeah.
It can happen.
Yeah.
How to go about it, I'm not very sure.
See, because you have so many errors, so in one
Yes.
error there must be some medical legal aspect, because someone who is quite literate, because of negligence from the medical sides, the person can think of, okay, I will go to court or something like that. So we
Yes,
need
it's
to-
possible.
Yeah,
It's
quite
possible.
possible. It's
Yes. But the thing is, we shouldn't allow it happened once with us. So next time we take care that every patient is monitored so that there's no miscommunication between two departments. So
Do you think this will keep confidential to the patient? Agar this error happen to this
no,
particular
it's not.
patient?
It's not communicated to the patient. Not as a part of this thing, quality or safety incidents. This is a completely different system. It's only systems. It's not individuals. Neither the doctor or this one will be directly blamed. Yes.